Okay, so I'm going to start my second video response for Chapter 2. Here we go. Much of the brain research you have read about in this chapter was carried out using animals, and in many studies it's necessary to euthanize animals to study their brain tissues directly. Many people object to this practice, but others say it's justified because it advances knowledge about the brain. Prepare arguments to support both of the following positions. The first position is the use of animals in brain research projects is ethical and justifiable because of the possible benefits to humankind. So undoubtedly, animal research has played a vital role in scientific and medical advances and continues to aid our understanding of different diseases. Much animal research is done with an ethical framework, and frankly, throughout the world, people enjoy a better quality of life because of these advances. For example, in some countries, prescription drugs must be tested on animals before they are allowed onto the market. To ban animal experiments like this would be to paralyze modern medicine, and it could also endanger human health by allowing products onto the market without testing their possible danger. The second viewpoint is the use of animals in brain research projects is not ethical or justifiable on the grounds of possible benefits to humankind. Okay, so on the other hand, animal testing, countless animals are experimented on and then killed after their use or euthanized, and unfortunately many of these animals receive tests for substances that will never actually see approval or public use. Even the animals that aren't killed during this research must live in captivity and can experience distress or pain, and animals should be subject to the same rights as humans. But aside the unethical aspects of animal testing, there is the argument that the reaction of a drug in an animal's body can be very different from that of a human, so simply put, animal testing might not be as reliable in certain situations. Alright, and the second question is, how would your life change if you had a massive stroke affecting your left hemisphere? How would it change if the stroke damaged your right hemisphere, and which stroke would be more tragic for you and why? God forbid, but if I ever suffered a massive stroke affecting my left hemisphere, much noticeable damage would result. The effects of the stroke in the left hemisphere can be really long-lasting, but they vary from patient to patient, and it can include trouble with talking, walking, swallowing. My memory might also be impaired. Hopefully therapy would help me return to my prior condition eventually, but like I said, it varies with individuals. But since the left side of the brain controls the right side of the body, right side paralysis is likely to be affected. Language is also really commonly affected after a stroke in the left hemisphere, but depending on the location, production and comprehension might be affected differently. Also, numerical skills might be affected. And like I kind of mentioned before, someone with a left hemisphere stroke can develop aphasia, whether it's Broca's or Wernicke's, which would mainly be whether it affects production or comprehension. On the other hand, if I were to have a stroke in my right hemisphere of the brain, left side paralysis may be an effect. There can also be disturbance in sensory perception, visual spatial relations, and as noted in the book, it might be hard for patients to orient themselves spatially, and unilateral neglect can be a big issue with right hemisphere lesions. Unilateral neglect would be to deny the existence of objects in the left visual field, which can cause huge problems with people either completely disowning their arm or just eating off the right side of the plate. It really can vary, but it does pose a lot of restrictions. The patient may also be emotionally damaged, seeing that the right side of the brain specializes in emotional thinking. But overall, I would say that the right hemisphere stroke would be much more debilitating. They usually present, like I said, visual, spatial, perceptual deficits that can result in unilateral neglect, which is not seen as far as I know with the left-sided hemisphere. And the fact that judgment difficulties can tend to show up in the behavior of their patients and emotional difficulties make this kind of stroke very dangerous. Okay, so that concludes my questions for the Chapter 2 Critical Thinking. Thank you.